So if you have any questions, please raise your hand, and we will try to unmute everyone. You can go one by one, or if you have any questions for Dr. Anand or Dr. Selva Shunmugam, please specify that the question towards who, and also ask very short questions. So we want to give more chances to everyone.
Sivasalam, I'll start off this for Dr. Anand. In your research or in your experience, as fasting helped reduce LDL or increase HDL? That's my question.
Dr. Anand, unmute yourself.
Excellent question, sir. Thanks for asking this. Definitely, we see a very good impact in cholesterol profile, blood pressure, and diabetes. All the metabolic syndrome factors improve along with weight reduction when people undertake mindful eating. One of the aspects of that is fasting. Thanks for that question.
Participants can now unmute themselves and ask questions.
Vanakkam, doctor. One question is, when people fast, some people have reported that there's a temporary increase in the cholesterol because the fat storage is being broken down. Have you observed that also, and any thoughts on that? Thank you.
Intermittent fasting does not cause much changes. Prolonged fasting, that means more than 24, 36 hours, going to 2 days, 4 days, 5 days, you see a significant alteration in the lipid profile, but even that profile is not unhealthy cholesterol. So the changes that we see in cholesterol, by and large, if people undertake the way Dr. Selva is clarifying with ancient wisdom, it's definitely going to help. From my standpoint, I'm not trained in traditional medicine, so I get insights and input and guidance from Dr. Selva on how to present this to the Western population. And we don't have the opportunity to educate on these specific things yet. Hopefully in the future, we will be able to offer detailed guidance for our patients. But right now, we suggest calorie restriction and anti-inflammatory foods, predominantly plant-based, whole food diets, things like that. And we don't see any adverse lipid abnormalities at all. Whatever we see is healthy, and it tracks the weight reduction.
There's a question
Thank you,
from
doctor.
Tiriswami. There are few myths on the market, such as semaglutide or Ozempic for promoting weight loss. Would you recommend? If not, what complications?
Excellent questions, all of the questions. This one has come up only in the last 2 to 3 years. The latest pills, the medications, injections are very effective. Ozempic and Mounjaro, we see a lot of good results with these agents. And in people with extra weight, in people with diabetes, and also in diastolic heart failure, we have good published data saying weight reduction is very important. In my own practice, I am not the one quickly prescribing these medicines. The reason is the studies have shown only at 6 months to 1 year the beneficial effects. And much of the challenge remains in long-term compliance, which is not yet available. Many people, I would say 60, 70, 80% of people trying these medicines give them up within a year. So if they see benefits, we are happy. But if they give up the medicines, the real challenge is all this weight is going to come back. So what Dr. Selva is suggesting seems like people have to learn a lot of specific cooking and medical advice. What I'm suggesting seems to many people initially very foreign, because I ask people to embrace a lot of simple lifestyle but diet changes. But at the end of the day, our ideas are empowering patients. Whereas even gastric bypass surgery, which has been around for 40 years, and the newest pills, Mounjaro, Ozempic, they are effective up to 25 to 25% weight reduction, which is very, very beneficial clinically. But we don't know the long-term sustainability when people are not able to take these medicines beyond 6 to 12 months.
Thank you, doctor. The next question from, I don't know who's that, US. How to stop breathing through the mouth while sleeping? This results in burp as soon as waking up. Is it due to food or block in nasal passage? Dr.
Dr.
Selva?
Selva, would you like to try answering this question?
Please, you give some your opinion, and I will answer followed by.
So the question is, if you have reflux, can you repeat the question?
Yeah, how to stop breathing through the mouth while sleeping? This results in burp as soon as waking up. Is it due to food or block in nasal passage?
So a lot of people have sleep apnea, snoring and mouth breathing. All these challenges we are seeing increasingly in this day and age because of disrupted sleep cycle. We are exposed to blue light from cell phone and TV and media, and people are under way more stress, working longer hours and extra weight. All these things add to poor sleep hygiene. So that is what needs to be fixed. And many of my patients, I ask them to finish their last meal at least 4 hours before going to sleep. In that case, digestion is completed. There is much less risk of reflux. Excellent question.
Dr. Selva, your opinion?
Yes. Before going to sleep, you do some steam inhalation with some herbs. That is tulsi, mint leaf, steam inhalation. Yes. Is it audible?
Yeah, you can talk, doctor.
Yeah. Okay. So tulsi leaf or mint leaf is easily available all over the world, especially in US. So take a steam inhalation, and as Dr. Anand suggested, 4 hours or 4.5 hours before sleeping, you finish your dinner, and take some herbal decoctions. So dried ginger and cardamom decoction, you can add with honey. It is very beneficial for mouth breathing. Thank you.
Thank you, doctor. The next question is, does thyroid removal affects the heart? Dr. Anand, can you?
Thyroid definitely is a very important mediator of metabolism. So when the thyroid is over-functioning, there is a risk for heart problems, and if the thyroid is not functioning well, there is significant risk for heart problems. And if there is thyroid removal, we have to check thyroid levels. Some people undergo partial thyroidectomy, some people undergo total thyroidectomy, and based on the need of the person that is available from a blood test, TSH, we decide how much thyroid replacement. Luckily, it's a very inexpensive medicine, that is thyroid replacement, and it's available for several decades. We have to appropriately replace thyroid. Some people use thyroid supplements to try and lose weight. We are not recommending that.
Dr. Selva, your opinion?
Yes. Along with the thyroid medications, you can use the Karisale in Tamil, Bringraj in Sanskrit, that is Eclipta prostrata, that is available in the market. So you can mix Eclipta prostrata with the pepper powder, and you can take 1 teaspoon in the morning, 1 teaspoon in the evening with the honey. We are giving some specific medications based on the pulse reading. We are giving coral preparations, coral in Pavalam in Tamil, coral preparations, as well as Muttu, that is the pearl preparations, for specifically for after thyroidectomy, enhance the heart health. Thank you. Thank you, Ram.
Thank you, doctor. Next question from Dr. Try. Thank you, Dr. Anand. I would like to hear more about and also he was asking about what is black cumin? Is it kalonji? It's not kalonji. That's for Dr. Selva. Dr. Selva, what do you mean by black cumin? Is it kalonjin ketkanga? Then for Dr. Anand, I would like to hear another seminars, some more about your method or outline. We will like to do another session if time permits and if Dr. Anand is available. Thank you for your suggestion.
Definitely.
Dr. Selva, he is asking, is cumin is black cumin is same as kalonji?
Yes, yes. It
Right.
is otherwise called as kalonji, black cumin seed. Yes.
Right.
Karanjiragam in Tamil.
But only one thing I want to clear, because I have experienced myself here, that one, you get it in the Indian grocery store, you have to really look for black cumin because they are selling onion seeds as kalonji. That is not black cumin. So you have to really look for black cumin. It looks different. It looks like a cumin seed, but it's little longer and black. But kalonji will look like a sesame seed, the black kalonji what that's available here. So you have to be really careful in that because I have experienced the same thing here.
Hello, this is Praisuri, Dr. Praisuri. I asked this question. Thank you very much for this thing. And if I may add something about the thyroid, and I agree with both of the doctors' answers. What happens is as we age older, our thyroid function goes down, and then we tend to replace the thyroid. And thyroid replacements very slowly should go. Sometimes what people think is when they think if they get more, then they can get better. So higher the thyroid function or higher the thyroid hormones, the heart is affected. If even it's low, is affected. When it's high, it makes the heart work harder. So we have to be very careful in replacing, especially in the old age. Thank you.
Thank you, doctor. And also there someone have asked like where we can buy herbals that is suggested by Dr. Selva. Dr. Selva, you want to answer that?
Yes, it is available in the US market. There is a Banyan Botanicals and Amazon has very good online marketing. All the herbs mentioned in this session is always available in the US market. I think you, Dr. Thamari, Mrs. Thamari can also suggest something.
Yeah, most of the herb that the doctor suggested is available here, either in the Indian grocery or online. There are so many online products are available, particularly the one that, what's the doctor, US Botanic, something in the Amazon, right? That is really good. They have a good variety of those. The powder, the dry ginger powder and the hariteki powder and all these things are available in Indian store. You can get it in the Indian store, whole or the powder, anything is available. And the next question is goiter, how to reduce?
Selva, your video is off. People cannot see you. In case you're able to come back on video. Do you want to take that question on goiter, Selva?
That is a goiter. It's that is a two different type of goiter here. In clinically, we observe. The first one is the hypothyroid conditions, but some cases thyroid is normal, but the thyroid gland is enlarged. So in both the conditions, we give some herbal treatment based on the causative factors of the disease. So cumin seed, moringa leaf, some other herbs is effective against the goiter along with the standard care. So in the integrative approach, the mixing the standard care as well as the herbal combination is useful for overcoming the goiter conditions. Dr. Anand, you can also
Excellent,
suggest something.
excellent. I don't have much more to add.
Okay, the next question is, doctors recommended BP medicine because lower number is close to 90. My brother started the medicine. Can this be brought back to normal without medicine?
So only in the recent years we have seen.
Dr. Anand, we can't hear you. Can you unmute?
Only in the recent years we are seeing very good blood pressure response because we are reaching a sufficient threshold in weight reduction. For people who don't have extra weight in the body, we still use our heartful living methods, but it has to be more with education, tailoring, and specifically walking along with the patient on understanding the program. But if there is extra weight, I feel working on that is so important to help reduce blood pressure and to reduce the need for lifelong blood pressure medications.
I would like to add something here. Many of you are asking about a lot of these recipes, the Annapodi and all these things. All these are available in our website. I have posted our website address also. Please go and refer. There are so many recipes, and all this GCSMR meeting is recorded, and everything is available in our YouTube channel for free. Everything we are doing it for free. You can go and even refer to past GCSMR webinars. Everything is available, and also I have posted the WhatsApp group. You can connect with us with the WhatsApp group. There are so many WhatsApp groups from each city. So if you are from Atlanta or Charlotte or anything, you can connect with us. The WhatsApp link also I have put in the chat, so you can connect us anytime. Some of you have raised your hands. Ruben.
Tamarai, I would like to answer the previous question.
Okay, doctor. Yeah.
Simple things. There is a pranayama. I mentioned in my slide, there is a 4 different type of pranayams. There is the conscious breathing. The second one is the Nadi Sutti pranayama, Om pranayama, and Prana Sutti pranayama. So we give specific advice to the specific persons without using the medications. For the stage 1 hypertension patient. Stage 1 hypertension patient is systolic pressure 140 to 159, diastolic pressure 90 to 99 millimeter per hertz. So along with some herbal supplements, pranayama will definitely help to reduce the systolic and diastolic hypertension. Thank you.
Hi. Hello.
Yeah.
Can you hear me? Yeah, this is Jagadish from Masami from Chicago. Actually, I'm a classmate of Dr. Selva Shunmugam. I'm doing a medical research at the University of Illinois at Chicago. So we are studying on the mechanism of this, how the fasting and what are the mechanism. And I just have a couple of questions to Dr. Anand. When you're doing the clinical trials, do you have any mechanism for all your studies? Is it fasting or this Siddha drugs? Is there any mechanistic approach you have done, any biomarker, or do you have any repository in your studies, and how big your trials are? Sorry for the many questions. I just want to get a highlight from Dr. Anand first, and then Dr. Selva Shunmugam.
Excellent, Jagadish. So nice to meet you. We'll talk offline. So I'm happy to chat some more. The thing is, in Missouri, where I worked for 18 years, this was mostly my giving back to the community, just wellness. But because the results are so interesting, now in Charleston, this is intentional, so it's prospective, and we are able to guide patients upfront saying, these are the challenges, this is where we want you to move towards. So the markers we are measuring are biological markers for inflammation, cholesterol, the metabolic markers, weight, and mental health also we are tracking. And within a year or two, we expect to show significant improvements in several areas, not only in heart failure, in hypertension, in diabetes, in pre-diabetes, in hyperlipidemia, and even in mental health, overall medication requirements, functional status, a lot of things we are looking at. We are putting together the needed technology to support this type of lifestyle transformation. And luckily, because reimbursement from Medicare, Medicaid, private insurance is increasing for remote patient monitoring and technology, we are able to support the services, the medical assistants, nursing, physician assistants that are part of this team to try and deliver this care.
So are the trials are in US or in India or both?
I would say it's mostly patient care based on which we are able to publish outcomes. We don't need to do a randomized clinical trial because trials are meant to first prove that what we are doing is not harmful. Second thing is whether it is better than something else that is standard of care. We are not going against the standard of care. Whatever is standard of care for whatever condition in the Western system, we add this complementary on top of it, and it's just a mindful lifestyle. So we don't need to work against the system. We can work with the system. But obviously, we would at some point like to do blinded randomized studies also on specific aspects. But by and large, most of what we are able to implement is safe enough that it's just lifestyle.
Yeah, this is awesome. You and Dr. Selva Shunmugam doing. I'm happy to collaborate if you want to do any clinical trials in this related to prove how the Siddha system of medicine is improving not only obesity and diabetes and the overall health and increase the lifespan. Obviously, that's true, but the only thing is the lack of evidence and publication, and according to WHO. So really, my best wishes for both of your journey. Happy to join in case if anything
Thanks
needed.
so much.
Thank you.
Thank you, Dr. Jagadish. And also, I'd like to specify that we have a separate group for doctors and researchers because they want to take this in details. And as you know, the Global Center for Siddha Medicine and Research, we concentrate more on research. So we have a separate group for that. I'll post that WhatsApp group link also. And also, some of you have raised your hand. Kamala Devi. Kamala Devi, can you unmute and talk for just short and sweet?
Thank you so
much. One more information to declare to you.
Who's that?
Can you hear me? Yeah, can you hear me?
Yeah,
Go ahead.
I can hear Kamala Devi. Yeah.
Thank you. The question is, I can't say yet. I would like to hear from both the doctors. Fasting consciously. Fasting we do with consciousness, right? Like skipping food is something else. Like I end up eating 1 o'clock, take the medicine also at 1 o'clock. But fasting involved a little bit of preparation and all that. It's tough to do fasting. Skipping food is very easy, but skipping food, will it help?
Skipping food will not help because the body is like a rubber band. It stretches, so it's going to recoil. It's going to eat more and it's going to regain all that weight. Fasting is the way intermittent fasting is practiced in the Western system, even that has not been proven to make a big difference. It is also a diet, just like this diet, that diet. Intermittent fasting is also tried. People enjoy it for a few months, lose some weight, and then even that weight regains. What Dr. Selva is teaching is a way of life. What I'm suggesting is using technology to support that empowerment. So this is not fasting. So I would say this is a way of life itself. Selva, if you want to answer anything else.
Okay, you are clearly explained. The lifestyle, diet, yoga practice, and the simple exercise, sunlight exposures, deep breathing, sun salutations. So these are all helpful to overcome these are all mentioned as a primordial prevention methods in the system. It is very
Thank
much
you.
needed. Yes, thank you.
Thank you, doctor. One more question I have. I went to the heart specialist. Your heart is like 20-year-old. I'm 71 actually. Like 20, but there is a noise rhythm. I didn't quite understand, and I didn't take into my mind much. If I remember, he said lower chamber and upper chamber, there is a difference in the rhythm. And he gave me medication. I took it one day. I had terrible pain. I never had that before, so I stopped it. Is there anything you could help me with, suggest?
We'll need to look at a lot of information to guide this further. It looks like you might have had some type of arrhythmia, and chest pain should not happen with these medicines. So I'm not too sure what happened. So we'll have to go into a little more detail to answer and guide you further.
Okay. Arrhythmia can be cured, or I should be on medication?
No, even that a lot of times can be improved, sometimes cured. And again, depending on how the underlying heart condition is, we've seen very good results with lifestyle.
Okay. He told me that I have a 20-year-old heart.
Good.
Thank you. Thank you, doctor.
Thank you. Is there any questions? I think we're done with the questions. I have posted all for doctors and researchers, there's a separate WhatsApp group. And for the common people, for everyone, we have another group. Please join us. We will be updating you with this kind of webinars and what are the projects we are going through. And as we told you earlier, we need a lot of your support. And also we do wellness consultations with Dr. Selva through the phone. So you would to do any kind of consultation or wellness coaching. I will say more like coaching. There's a form available in our website, so we can do wellness coaching with Dr. Selva. And what are the products available online? We cannot put that in the website, but if you have any useful links, everything is available in the website. And the food as medicine, the necessary food that we take every day, very small recipes, herbs, everything is available in videos. And we are also updating upgrading our website. So within few weeks, we'll have a wonderful website with all those information and projects in the Manipal University and with the Moorhouse School of Medicine, and so many things going on. At this time, I would like to thank Dr. Selva, who is our backbone of this organization, who did most of this heavy lifting and the Siddha part of everything. Dr. Selva, Dr. Arvind, and Dr. Uma Sendil. I think Dr. Uma Sendil also joined this session, I think so. So thank you, doctor, for all your support you are giving us. And I'd like to thank Dr. Shankari Sivasailam, who is also part of our advisory board, and Dr. Rajagopalan Sridharan, who took care of this Moorhouse School of Medicine projects, and it's been going on really well. We will keep you updated. Our next webinar is going to be about the students who are visiting India for these projects. We will update you with the date and the day of the meetings. And if you have any suggestion of any health topic, please suggest to us. We will arrange one for all. It's completely free. Doctors who do this webinar, they also do it for free. Thank you to every one of us. Please keep along with us. We will be updating in the WhatsApp groups, and also you can see in our website about our upcoming projects and upcoming webinar. And if you have suggestion, please do so. As we always said, that our president said that nothing is possible, without money. So we would like to thank our donors, but still we have a lot of projects that need donation. You can either donate here in US or in India also for the project that is in India. Please contact us. And you have any other suggestion, please let us know. Rama, can we finish the...
Total finish.
Yeah. Okay.
Yeah, before concluding, I think Venkat Ramani, he has been waiting for a while. Just very quick, Venkat.
Yes, ma'am. Because I want to share with you, because our Siddha medicine is absolutely research purpose. Cambridge University is applied for seats for Siddha. This information to you. This is one of the milestone of our Siddha medicine. Cambridge University and Harvard University, they have researched in MBBS student for Siddha medicine, for alternative for the allopathy. This is for sharing with you.
Thank you, Venkat, very much. Thanks, everyone. And
also, we would like to emphasize 1 minute, Amma. We would like for Venkat, we have this Varma therapies course for a lot of people who are in the medical field.
Yes,
so
yes.
please, why don't you go through that? And Dr. Arulamudan is working on that in the Manipal University. It's a certified Varma course that's not available anywhere. The first time we are having a MOU with Manipal University, and these Varma courses are available for all the people who are in the medical field. So more information is there in the website. You can refer to your friends who are in the medical field and everything. So a lot of information are available, and please refer to the website. We have all the affiliation, all the projects and everything. And you can contact us anytime, GCSMR20@gmail or through the WhatsApp groups. We will always there to answer you. Thank you.
Thank you.
You can thank you, note, Rama.
Thank you very much, everyone. I want to end with two very important things. As always, it's only because of you we are surviving as an organizer, and we would appreciate any donations from you. Please donate generously. Whatever you can, every little thing is adding on to the big pot, and for a bigger and a better cause of human health. That is our basic aim, that we want to give better lifestyle, better health for the declining health aspects of human right now because of all the technologies. As advancements grow, complications grow as well. So please consider donations. And we would like to also thank everyone, and keep us in your loop. And also all the information is available in the website, and all the recordings will be available in our YouTube channel. We will share all the link with you guys. So please connect with us in a chat WhatsApp group, and we'll keep you guys updated. Thank you very much. And also one very important thing, whatever health ailments you have, don't do it yourself. Please contact your health provider. And whatever we are saying here is for a better health and lifestyle. Do not do anything against your provider advice. Thank you very much.